Hello and welcome to Season 3 of the Disable the Label podcast. I'm your host, Kerry Winfield, and this is the place where we amplify voices, break down barriers, and celebrate stories from across the disability community. This season, we're bringing you even more inspiring guests, raw conversations, and empowering insights to spark change and create connection. Whether you're part of the disability community, a parent, professional, or an ally, we are here for you. So let's get comfy, hit play, and join us as we continue to disable the label and redefine what's possible. Let's dive in. Welcome to the podcast, and today we have Eniko. Eniko, welcome.
Hi, Kerry. Thank you for having me on your podcast. I think you picked a really important topic because I'm not sure if many parents are aware of the importance of an educational healthcare plan and their legal rights around it. And then hopefully if the professionals who work with our children listen to your podcast, which I'm sure they do, then they will get loads of useful information as well. So as you said, my name is Eniko, and I work for the Rainbow Centre for Conductive Education in Fareham, and we work with adults and children with different neurological conditions, and I lead the children's service. I have also recently completed my level 1 and level 2 training in special education and needs and disability law, specifically around educational healthcare plan. And hopefully by Christmas, I will have my level 3 completed as well. So thank you for having me.
Amazing. Yeah. Yeah, thank you for coming on. Eniko is a font of knowledge. I've known her for many years. She was the person that trained me to become the conductor that I am now today. So I'm really grateful to have met her. But I know she has so much knowledge and is really passionate about this kind of subject, especially EHCPs, because as we both know, it's a subject that is not spoken about enough, and it's not necessarily explained that well to parents. So that's why we decided to do the podcast today. So let's kind of start at the beginning and kind of explain what an EHCP or Educational Healthcare Plan is.
Okay. Right, so it's a very long word. So I will refer to it as EHCP, but it stands for Educational Health and Care Plan, which it says it in the name, very self-explanatory when you start thinking about it. It should really combine all of the care around the child, including their education, their health, and their care. So sounds very easy. So the plan will look at what the needs of the child is, and then provide a provision to meet all of those needs. It will also include short and long-term outcomes, which professionals and the families want the child to achieve. And then lastly, it will include the placement of the child in one of the sections. So that might be an earlier setting, it could be a specialist setting, it could be a mainstream school, dependent on what provision is put in place, which these placements can offer. It is such an important document, and I want all of the parents to think about it as a passport or a Bible to their children. There is no other document as important as this, and if it's written well, it will last for up until they're in education.
Yeah, and that's like in kind of, I know obviously people think about this as childhood, but that goes for saying it helps them as they're going into college and also into university, because if you have something in this, it's a legally binding document and it shows that they need it. So if they need it, then they're more than likely going to need it going on throughout their life. Obviously it's ever changing, but yeah, it's not just about when they're 4, when they're 5 starting school. It's all the way through. It's like a massive part and chunk of their childhood, really. So what is the importance of an EHCP? Why is it so important?
It is because it should be all around the child. So it was the first document in 2015 when they changed the SEND law and the new SEND Code of Practice came out, which was built on the Children and Families Act 2014, that really put the emphasis on child-centred and family-centred. So the young person, when they kind of got to the age where they able to have a say in their education, health, and care, can have a say in it. But up until then, the families should be really the advocates for their children, and it should be really including the family and the young person. As you said, it lasts for the whole childhood and then sort of young, early adulthood, as long as they're in education. And a really bad misconception is that it's a document for school. It isn't. You can start it as early, I have got children at the moment where I'm talking to the parents, starting the whole process, and the children are just 2. So that I want to kind of bombard this myth where it is a document for school. It isn't. You can start it with professional help as early as you wish to.
Yeah, and also I think what's key and a part of that, I think, another misconception is that school should be starting it. Their teacher should be doing it, or their SEN at school should be doing it. That's completely incorrect.
Yeah, I think what's really important, Kerry, is that you have got professionals who have got really good knowledge of this whole process and are able to support the families. Sadly, we know how much early years is struggling in this country, and there's less and less training available for our early years practitioners who do their utmost best to support the families as early as possible. Special educational provision, particularly in the early years, as far and few between. So what it means that most of the children with additional needs are in mainstream nurseries, which is fantastic because obviously inclusion is a massive part of this code of practice I've talked to you about. But it means also that those practitioners haven't got enough training in recognizing all of the needs of a child, and also to really take part in this very complicated process. And they haven't got the resources.
Yeah.
Either.
No, and that actually probably won't ever change because there isn't necessarily the resources ever going to be there. But if parents have other professionals around them, like for example if their child goes to a private therapy or conduct education centre or whatever it may be, those people can still help that process. So let's talk about then the length of the EHCP. We all, I don't know how many parents know who are probably listening to the podcast, it is a long document, isn't it?
It is. And also maybe I need to ask you, how much time do you have this morning? Because sometimes this process is really, really long. So obviously there is a statutory framework around it. But again, it comes back as everything during this podcast, I will emphasize it. A lot of the times, this is dependent on resources available within educational setting, resources available at the local authority, and then also funding available. So it will always come back to this. So I tell the parents what the statutory framework is. I tell you the timeline, but I will also sadly give you a very dim picture of reality as well.
Yeah.
So I did mention that there's several laws around this, and the reason I think it's important that I tell the parents, because they can look up themselves. It's not too difficult nowadays with the internet to look up your legal rights. So the Children and Families Act 2014 is a really important one. I always say that was written not definitely for solicitors, but if you wanted a more reader-friendly version of it, then I can highly suggest the SEND Code of Practice 2015, because that is very reader-friendly, very easily understood, and very well structured actually. So there's a wealth of information in there. So from the moment a professional or a family decides that they've got enough evidence together to submit a request for an assessment, the moment you push the button or send off the documents and it's been received by the local authority has to make a decision whether to progress with the assessment within 6 weeks. Okay, so that is just to go, right, we've got all of these evidence, we've got loads of professional reports, we've got, reports from the person submitting the request. this is great, fantastic. We can see evidence that this child potentially will need an educational healthcare plan. So they've got about 6 weeks for the local authority to decide this. And it tend to be the children I work with, but I have to emphasize this, that most of our children at the Rainbow Centre have got complex needs, that not once we had a request what's the word I'm trying to think? I've gone. Rejected, that's it. But also, I don't submit a request unless I know I've got all of the evidence together. So it's really key. I know we will talk about that in a little bit. So anyway, so the initial one is 6 weeks. Then the local authority will come back either, yes, we will progress with the assessment because we can see enough evidence, or no, we won't. If they say yes, then they have got a further 14 weeks to assess the need of the child. So that should include, and it must include, education, health and care. So they will contact all of the professionals within that 14 weeks period who in contact with the child, who knows the children best. And this could include earliest professionals, physio, OT, pediatrician, neurologist, conductors, teachers, anyone. And I must tell parents that if you have got private professionals involved in your childcare, please let them have their contact details, because the local authority has to include their professional evidence as well. So don't be afraid of including them. And then at the end of the 14 weeks, they should come up with a draft plan, which is basically all of the reports they gathered together in the 14 weeks period, then translates into the draft plan. I always laugh at this bit because obviously the local authority has got 14 weeks to put a plan together. You as parents and us professionals have got 15 calendar days, so not working days, 15 calendar days, then to review the plan and make representations of the plan of any changes. Okay, so very unfair, totally, because it's not a lot of time, particularly for a parent who's not that involved in the legality of this process. So it's always good to have a consultant on board or a professional who you as parents know have got a wealth of knowledge. So really the whole process shouldn't take longer than 20 weeks. Says she, it does. So the longest process I have known was over a year. Okay. And that could vary anywhere in between. All local, again, because I'm pretty sure your podcast is not just going out in Hampshire. So all local authorities are different. So the process is different. The timeline shouldn't be, I must emphasize, the timeline is the law. Okay. But the paperwork is different. How they conduct their whole process could be different. Some of them still in paperwork, some of them are already online. So please be aware that you need to kind of talk to your local authority representatives and to your nurseries to know what you have to do. But if you put in your search engine, EHCP applications, then it should bring up and take you to a SEND page where you can find all the paperwork and explanations regarding to your local authority.
Okay. And you mentioned obviously earlier about having somebody support you in your application. I think that's something that's really key, that we've said, both of us have said, is really, really key, because as a parent, you obviously can apply, just you starting it. But if you have the support of anybody, they don't have to be the teacher, they don't have to be your your practitioner. It could be somebody private, like you from the Rainbow Centre, or a private physio. Anybody can support you in the starting of that application, and then then you have somebody there that's also looking out for those little tiny things that you as a parent may not be looking out for and checking, right? Because that process of them coming back with the plan and you having only 15 calendar days, it's really tight. Obviously, I know you're having to rely on how much time you have, which you may have loads and loads of hospital appointments in that time, and also how much time the professional has that's supporting you. So if you know that person and you really trust that person, that's really key. I think that the trust between you and that person that is applying can really help you then get what you need, and that's really key, isn't it?
Yeah, it is. And I advise parents making the application themselves. And I had where parents didn't listen, they applied and it was refused. They didn't even assess the needs of the child, sorry. And one very scary experience I'll share with you. So I do sort of information event for our parents at the Rainbow Centre, and I had several barristers and solicitors attending these information events. So that just shows, it was really scary because I thought, what can I tell a barrister or a solicitor about SEND law? Like I was sitting there, I was really kind of scared, and but they said they're like any other parent because obviously their specialty wasn't SEND, hence the reason they came to my information event. And actually even they, really thinking hard whether it should be them who's starting to process and not somebody whose specialism it is to oversee it. And also I think, as a parent, you're quite subjective about your child. And, at the Rainbow Centre, we always, and within conductive education, not just the Rainbow Centre, we always really positive, and we always look at, what the child can do. And, we talk about all of our children achieving massive milestones on their own level of development, whereas an education healthcare plan does celebrate the child's successes, absolutely, but actually you really have to look at the children on their worst day and what does that look like, and translate that into the educational healthcare plan. And as a parent, that's really hard. It took me as a professional several years to kind of understand why I need to look at what he can't do and what she can't do. So I think it's important to have somebody involved who can look at the children more objectively.
Yeah, 100%. I think it's really hard, right? Because even on the podcast, I talk about, like, let's not talk about what the child can't do. Let's talk about what the child can do. And obviously that's definitely like a conductor thing. It is another professional things. Other professionals do that. But if you have a professional that one knows your child at their best and at their worst, but also can step back and go, however, if they're in this situation, it could look like this, and they might need a little bit more support. It's very different being at home with your child because you don't have the hustle and bustle of school or nursery or whatever setting it is that your child's going into. And sometimes a professional can step back and go, okay, let's think about all these kids running around them. Yes, they can stand, walk, but do they need that extra support to make sure that can happen? Those little tiny things a professional can do, whereas as a parent you're most definitely should be celebrating your child and saying this is what they can do. But it's really hard to then go that they can't do this, they really struggle with this, because that's kind of in a way getting your head into a negative space, which we obviously don't kind of push on our parents. We like them to see all the positives, but in this scenario it's kind of has to be done because you want them to have the support at their worst, not just at their best. Because if they're only having the support that they need at their best when they are at their worst, they're going to struggle. And especially in school, if they're just starting school, that could be for the first 6 weeks, right? Because it's really tiring for them to start school and stuff like that. So that's why it is definitely important to have that professional there supporting you and saying, yeah, I know they can do this. However, do you remember in this scenario, they struggle with that? And then it's kind of helping you as a parent explain why we're having to look at those kinds of things.
Yeah, and I always tell parents that they are the expert in their children. Not me, not any of the other professionals. They are the expert, and they've got every right to stand up for their children's rights, and also every right to fight for an education and health and care plan which is suitable for their children's needs. So I hope that by the end of this podcast, parents will feel empowered to know what they can do to support their children.
Yeah, 100%. And I think that's where it's key to have both, because a parent can say, well, actually, you only saw them, a consultant only saw them for 10-15 minutes. So yeah, they saw them like that, but that was at their best. And actually at their worst, they really can't do that. And that's why it's really important to have the two professional and the parent, because the professional can kind of pinpoint and be really specific. And even if that's because a parent can explain that to them, and then, it's, and also there's lots of language going on in these things that, some parents might not be used to, as we're both aware. So the application process, what do parents need to do?
Okay. So I always encourage parents to keep all of their child records neatly filed, because when it comes to the assessment, they won't get flustered, and they won't have, they basically save themselves time. If, as you start having different professional reports in either via email or in paper format, you then file them correctly, either on your computer or in a paper format. Some parents, when I say to them, I need all of your professional reports, they come, ta-da! And then they come with a beautifully organized folder. So I think you save a lot of time for yourself if you start filing these right from the beginning. And I can't emphasize that enough, that not just statutory service reports I'm talking about. I'm talking about any private report you might have had, even if it's just for an assessment, or whether you've got a private professional involved, physio, OT, speech and language, all of those count. Everything counts. So that's the first step. So be as organized as you can be in a hectic household, because it will save time for you. The second one, which will be a key, is obviously think about who you want to be your lead professional if you choose to have one. So this could be, as I said, somebody from the earlier setting your child goes to. It could be a private professional. It could be obviously your NHS physio, OT. However, I've not yet heard them doing any of these applications yet, but that doesn't say they can't. Okay. It tends to be the educational setting doing it. So it's either the school or earlier setting. In our cases, I do it at the Rainbow Centre. We do gather information if you can. Listen to the podcast from Carrie. That be the first step, because you can get a wealth of information. At the Rainbow Centre, we do lots of information events with parents, both in groups, and then I do individual ones as well, which is specific to their children. Then the parents, and again, I will use the term our stories, but that might not be the one in your local authority, but it tends to be, around your child's life. And in an EHCP, we always look at loads of different areas, but we look at communication and language, social emotional interaction, cognition and learning, physical and sensory needs, then health, then care. Okay, and more or less, when you write what I call our stories, you need to write down what your children's strengths are in these areas and what their needs are in these areas. Okay, because that will be your contribution as a parent towards the educational healthcare needs assessment. It's worth reading up on it. It's worth asking your lead professional what needs to be in there. And also it's worth start writing it as soon as you think you want to start this process, because it's not an easy document to write well. Okay, so I always again say to parents, whether you want to do that on a computer or whether you want to do it, handwritten, start it and always add things to it as things crop up. Okay, so something happens. Oh my goodness, I've forgotten my child does this. This wasn't great. He had the most terrible tantrum. We couldn't handle his tantrum. It took him this long time to settle, and just describe it. Describe what happened. and how long it took, what it took for you to do it, what effect that it had on the family, on the siblings. It's got to be quite complex. So if you've got a lead professional, so in our cases, I always read the draft of our story, because again, I can look at it from as an outsider almost, and support the parents in writing it, because it's key. It will be added in one of the sections of the educational healthcare and plan. So this is even before we submitted the request. So everything I've just talked about, what a parent needs to do, this is before we submitted the request. So I just had a meeting with a parent yesterday, and I said to them, right, okay, so we're going to start the process. We agreed I'm going to be the lead professional. So I said to her, it's going to take us at least 2 months to get the documentations ready enough to submit a request. Okay, and then your 6 weeks then ticking from that. So you can see why I'm saying it's quite a lengthy process, and why I'm saying it has to be started in time. And the reason it's important to start it in time and not listen to, other professionals or particularly local authorities, that this is for the school. Because what you want really is, by the time you start visiting schools for your children, you already got an education healthcare and plan, and you can go, this is what my child needs are. This is the provision you as a school should be providing. Can you meet their needs? It's there. And then you can be sure that you pick the right school for your children. If you haven't got an educational healthcare plan, even with the best intentions, you describe your children to the receiving schools, they won't have that full picture from all of the professionals. So preparation is key, and starting it early enough in early years is key. As I said, we've got children at the Rainbow Centre who already had an educational healthcare plan by the time they were 2 and 3.
Yeah, I think that's something for me from this podcast I really want parents to take away, because if you're going and looking at schools without this, yes, you know what your child can and can't do and what they need, but you don't have proof of it. It's all throughout their whole life, it will always be about the proof. And I've obviously talked about this with like equipment and that kind of thing, but actually this is where it comes into play even more so, because you want to make sure you have the right school. Every parent wants to make sure, but you can't make sure that you do have the right school for them, and that they can say yes or no, they cannot meet their needs without that, because they don't know what their needs are fully. They only know what your side of things are. They need a whole picture. It's about the whole child, and that includes a whole picture of every single person that's involved in their life. Really, it's not just their education, it's their life. It's an education, it's a health, and it's a care plan. It's not just education. And that's, I think, what's kind of happened with this is people just look at it as an educational plan. It's not. It's the whole child, and that means everybody involved needs to be in it, and that then can dramatically change their school life. They could potentially go to mainstream school, start that, and go for the whole of their primary years if they have a good, great educational healthcare plan. If you don't, potentially you might not get that opportunity. And so it's about creating the right opportunities for your child and making sure they're seen as a whole, not just one section.
Yeah.
So I suppose the when and how is as early as possible is kind of what we're saying.
Yeah. That's one message, definitely, I like parents to take away, as early as possible. Because it's a lengthy process. So even with the best will, where a lead professional has got loads and loads of time on their hand, which nowadays that won't be the case at all, because we're all spinning so many plates, it's ridiculous. It takes time. It will take me, with the best intentions, 2 months to get all of the paperwork ready. And then, dependent on local authority, it could take anything from the statutory timeline, which is 20 weeks, as I said, could be up to a year. Because it goes back to workload. It always goes back. Those SEN coordinators at the local authority potentially looking after 300 to 400 educational healthcare plans each. So I really want to cut some slack for these coordinators, because they have got their work cut out. Absolutely, that shouldn't bother the parents, because at the end of the day, their child and their got their rights, and it's written in law. But hopefully, if you've got a lead professional, they will kind of take over some of that heavy load of the parents.
Yeah, totally. So what happens if it doesn't go through that that first stage? What then happens?
Okay, so as it says in the name, it should and must include a child's education, health, and care, all of their needs and all of the provision to meet these needs. And these sections are around these three areas of a child's needs. Sections are really long, so it starts with an A, section A, and then it finishes with section K. Okay, so I will go through and I will give a brief description of all of them. But if you go and research and Google SEND Code of Practice 2015, that will have a section explaining all of these as well. So if you don't remember, please don't worry, as long as you know where to do your homework and where to go. So section A is the parents and the child's views. Okay, this section is not legally binding, so you have to be aware that everything you're putting into your R story, which, as I did say earlier, it might not be called in your local authority R story, but everything you write down about your child will be added into this section. Okay, so it's really, really important that you write it well, focusing on the children's best day, celebrate who they are, already all of the things they can do, but equally you need to write down what their needs are and what you think as a parent they should be provided as a provision to meet those needs. Okay, so this could be certainly all of their NHS therapies, all of the educational staff included in there. If they already had a care needs assessment, which I will talk to you about in a little while, because that's further down the sections, that should be in there. But I can't emphasize enough, if you've got any private therapists, that should go in here as well. How often do they have it? What the effect those regular therapies had on your child's development, all of the positive outcomes. So everything you can think of should be going in there. All of their history, all of their medical history, all of the medical professionals has to be included in this section. The next section, which is, so the rest of the sections, which I will talk to you about, that will be based on professional reports. So if you remember, I did say about that everybody who is included in your child's education, health, and care will be contacted, and they will be specifically asked what we or they think your child needs are based on evidence, and what provision they will need to meet those needs. Okay, so section B will be based on these reports. Now, what a good section B looks like is specific needs. So it needs to be in health, they've got epilepsy, then kind of going down. Oh, I'm so sorry, I've made a mistake here. I'm just thinking needs generally, but section B is educational needs. Okay, because there's a separate section on health needs. So educational needs goes into section B, and these are in 4 areas, and I think I mentioned this earlier as well. It's communication and interaction, cognition and learning, social, emotional, mental health, and physical and sensory needs. Okay, so a well-written section B is very, very clear needs. So it's not like a whole sentence which might include a bit of provision, which might include the child's strength. It needs to be specific. So, for example, physical and sensory, lack of ability for independent mobility on the floor. unable to do sit to stand transfers, not able to sit on the floor independently, unable to communicate her needs clearly, unable to communicate emotions clearly, lack of understanding of social skills in social emotional. So that will go under communication and language. So it needs to be quite specific, because what tends to happen is these are long-winded sentences and you have to unpick what the actual needs are. And if you don't have clear needs, it is very difficult then to set up the provision to meet those needs and make those quite clear links. Because what I want parents, and if professionals listen to the podcast, obviously, to think about that every need will need a provision, okay, which will be section F. So section B, also legally binding. So I know we're going to talk a little bit about appeals and tribunal. In a case of a tribunal, there are only 3 sections which you can appeal against, and it's section B, which is the needs of the child. Then I will talk about section F in a minute, which is the provision to meet those needs, and then section I, which is the actual placement. Okay. So really important that if nothing else, these 3 sections are written correctly: section B, section F, and section I. Obviously, the aim would be all of the sections to be written well, because then that it gives the parents and the professionals working with the children a very clear picture of a child needs in all these 3 key areas. Okay, so I made a mistake earlier when I included the health needs, but the health needs need to come to a completely different section, which is section C. So this is where all of your child's medical diagnosis will go. So cerebral palsy, any different neurological conditions, epilepsy, issues with feeding, their vision, their hearing, any orthopedic issues, everything around their health. Okay, we'll go into this section. And again, that's important because later on there's a section on health provision. So again, you would need to know which health professional will meet which area. Okay, so if your child's got epilepsy, obviously you want a neurologist involved, you want an epilepsy nurse involved. In section H, which is your health, section G, which is your health provision, you need all of these, how often these people will see the child, what input they're going to be having, and what is the outcome we're hoping to achieve by all of this. So it's really important, again, that when you provide us lead professionals with information, all of your child's health needs has got an evidence against them. So that's a letter from your neurologist, your pediatrician, your orthopedic surgeon, if you've got one, or a teachers for a visual impairment, or ophthalmologist. I mean, the list is endless, really, but I just want you to think about the overall health needs of your child. Now, section D should be the child's social care needs. Now, this is my favorite one, because often once you receive a draft plan, it says no social care needs have been identified. Okay, and then I go to the parent and I say, well, has your child and your family have been assessed for social care needs? Oh no, we haven't. Nobody contacted us regarding that. Okay, so the local authority can't just assume a family hasn't got a social care needs. I try not to be negative during the podcast. I'm trying my hardest, but reality is that the local authority will tell you that until your child reaches the age of 5, they don't have social care needs. Okay, so they don't tend to put a package together to meet a care needs. Okay, but regardless, they can't say they have you and your child hasn't got social care needs without assessing it. So you can assist, you can ask for this and make sure that you at least have an assessment, because then when we talk about the annual review in a bit, during an annual review, your child's social care needs can be reassessed. Okay, and then when those needs maybe become more apparent after they're 5 years old, then hopefully you will be able to get some care package out of the local authority. But please make sure that you get assessed for social care as well, not just for health and education. Okay, so section E are the outcomes. So what is it we want to achieve by having this educational healthcare and plan? Some of the outcomes will need to be long-term. So local authorities tend to look at end of early years, end of key stage 1, key stage 2, key stage 3, okay? But they still need to be SMART objectives. In education, we're brilliant. We're really good at writing SMART objectives. So I don't tend to have issues with those outcomes. And again, please look at it when you look at the other sections, because for health, my favorite one again is to keep X and Y healthy. I mean, I could try my very best, but even with my very best, I'm not sure if I can keep every single child healthy. Okay, so that is even unreasonable for a professional, never mind for the child themselves. Okay, so again, within health, these outcomes have to be SMART, and keeping a child healthy is unreasonable and not SMART at all. So just bear in mind that your expectation should be the same towards health professionals as towards education professionals. Right, so the really big section is section F, which is the special educational provision. So as I said to you earlier, it needs to meet every single need listed in section B. And this then could be anything which educates and trains a child. And again, that is in the SEN Code of Practice. So everything which educates and trains a child must be included in section F. Therefore, occupational therapy, speech and language, and physiotherapy can be included into section F. And the reason it's worth fighting for, because if you do end up going to tribunal, obviously these are the sections which you can appeal against. B, F, and I. Now, there were some cases where the judge made recommendations for social care and health provision, and the local authority has to be sort of, what's the word? You have to really reason as a local authority why you haven't done what the judge has recommended, okay? I mean, some local authorities will go against the judge's ruling, but at the end of the day, these are only recommendations, so they can, okay? So the more you can get into section F, the better. So I'll give you an example for educate and trains, okay? So why I think, not just loads of other professionals, solicitors, legal advisors will say the same, is because then it's so you can get it into this section, and then the local authority has to provide that provision, okay? So for example, physiotherapy can go in there, and an example of that, okay, X and Y needs to change places and positions once every hour to enable them to have access to all learning environment within the classroom, okay? So that's already, why is it educating? It's because we want that child to have access to every learning environment within that school or with the classroom. So that could be whilst in their standing frame, in their classroom chair, in their wheelchair, on the floor, on a physio bench, on a peanut ball. I mean, you name it. There's loads of different ways to meet that need. Speech and language, I don't need to tell, I don't think, anyone why it's important to get it into section F. I mean, without communication, there's not a lot of learning will be going ahead. So it's worth asking for support with this, particularly when people go through the draft plan. And I know there's a little bit we talk about the draft plan as well. Okay, next, health provision. So that will be everything which, again, physio will provide. So, but this could be like appointments, how often, okay, how long for. This could be seeing the neurologist. This could be seeing your sort of ophthalmologist, orthopedic surgeons. Those sort of things will will go in there. Epilepsy nurse, all of these things. Now, with every single provision, and whether it's social care, health, or education, it needs to be specific. Okay, so it needs to detail the provision itself. So what I just said, X and Y needs to change places and positions every hour during the school day to access the learning environment within the classroom and within the school. So that's fairly specific. Then you go, okay, so how often this is going to happen? Every day. And how often and how long for? So changing places and position every hour. But this could be for 20 minutes, this could be for half an hour, this could be for 5 minutes. So how often, how long for? Okay, and what kind of support the child is going to receive for this. So that we'll have to say one-to-one, small group, but again, you want it to be specific, because a small group for me is 2 or 3 children, a small group in a mainstream school, 10 children. So it needs to be specific, up to 5 children, up to 3 children, okay? Or classroom environment with, with teacher support. And again, it needs to say who is the supporting. Is it a teacher? Is it an LSA? Is it a specialist TA? Is it a VI teacher? Is it the physio? Is it a conductor? Is it a conductor's assistant? Again, another favorite of mine, when an educational healthcare plan says school staff. Okay, well, that's the cleaning lady, that's the dinner lady, that's the, the lunchtime supervisor. It's all of, you have to be specific, and you've got every right to ask for that, to be specific. Okay, I can't emphasize enough. You have to feel as a parent empowered that you've got the right to a specific educational healthcare and plan. And also, if it just says school staff, okay, and then you go to the annual review, or you have a discussion with the class teacher and say, okay, so who has been supporting my child today? Oh, it was one of our parent volunteer. Okay, well, it can't be the parent volunteer, because in the EHCP of my child, it specifically says it needs to be a trained LSA or a trained TA who has got specialism in communication and language, or in moving and handling. And, I could just kind of list it's endless. Okay, and then section I is where the placement of your child will be named. Now, when you receive the draft plan as a parent, the draft plan does not and should not and must not actually include the placement. And I tell you why. Because also, when you're applying for an educational healthcare and plan, what I want all of the parents is think about is their child's needs. What is it? What is the provision to meet their needs? Because if you start thinking about a specific school, you will end up with an educational healthcare plan which is written what that specific school can provide your child with. Okay, and there is a massive difference. You want an educational healthcare plan written for your child, not written for what a school you've got in mind can provide. So that's really, really important. And this is actually why, section I is not filled out in a draft plan. Because ideally, once you've got everything in place, then you go, right, these are the schools which can meet your child's needs. Which of these schools you as a parent prefer? Because we mustn't forget that our children's schooling is parental preference. Okay, at first stage. Then, of course, we're dealing with waiting lists, with all of the SEND provisions being taken up in every mainstream school and every special school, but as a first step, our children's schooling should be parental preference. But there's loads and loads of things hoops you got to jump before you actually get a placement for your child. Now, section J is an interesting one. It's a personal budget. I haven't got much experience with that just yet, but basically you as a parent can apply for an assessment to have a personal budget, and personal budget should include payments for provisions which the school or health can't provide. But it's very, very difficult to apply for it, and very, very difficult to get it. So we, for example, encourage parents to try to get funding through personal budget for their conductive education sessions for their children, but it is very, very hard to do it. But it can be done, and you need to be aware that you've got right at least to apply for an assessment to have a personal budget included in your child educational healthcare plan. And then section K will just include all of the appendices. So those are all of the reports which were written, which will then form the educational healthcare and plan. It will have a key in the draft plan, because those will be really important when you and your lead professional, or legal aid, or whoever you ask to help you to review a draft plan, will use those appendices for reviewing the draft plan. Sorry, it was really long. I know it's very, very long.
No, and I think it needs to be. But I think what parents need to take away from that, if the key importance of every single section is be specific, not just on, for example, needing to change position every 10 minutes. That needs to happen throughout the day, and they need to be in that new position for the amount of time. It needs to be specific down to every single section, not just one part of it. Every single part of this needs to be drop down. So, and for parents, that may seem really difficult, but what I suggest is, if you have an example of them having to change position, which a lot of children with physical complex needs do need, you start with, okay, how often do I need to change their position, or having a physiotherapist tell them this is how often he needs to be changed, or they need to be changed position. You start with that and you break it down from there, because if you just say they need to change position, it's not specific enough.
No.
It needs to be broken down. So I think from the one major thing out of all of this is fill in every single section. Know which sections are legally binding, which is obviously B, F, and I. Am I correct?
Yes.
And thank you. And make sure you're being specific at every single stage, whether it's a legally binding stage or not. Be specific. Go really in depth in how specific you're being. The more specific you can be, the more you will get out of your EHCP for your child. Because you could say changing, they need to change places 5 times every day. Is that 5 times, in the morning, 5 times in the afternoon? Is that 5 times throughout the whole day? Is that 5 times every hour? Is that 5 times for 20 minutes at a time? Is that they need to be standing, or do they just need to be rolled over? You can think about taking something you read and doing the minimum, because that's what they're going to be trying to do with your EHCP. You want them to read your EHCP, and they cannot take anything but the maximum that is needed for your child. Yeah. If that's,
at the end of the day, it's
in a very, very simple
at the end
way.
Sorry, Kerry.
No, you carry on.
At the end of the day, it's very harsh to hear it as a parent, because even as a professional, it just makes me so cross. But at the end of the day, everything is down to funding. Everything is down. So the local authority will try and minimize it as much as they can, because that SEND budget each local authority has is just getting smaller and smaller. I have just recently come across an article about, most parents probably won't know because it's not that open knowledge yet, but there is another SEND reform coming up. The green paper have been out. We know that the budget is shrinking. The amount of request for assessment for EHCPs is growing massively, and have grown in the past few years. So shrinking budget, growing EHCPs, the maths doesn't add up, does it? So it does look like that there's going to be loads of pressure put on education section, particularly mainstream schools, to meet children's needs without an educational healthcare plan. That's what 100%. I've taken away from.
And what I've taken from all of this is, this may sound wrong, But the louder you shout and the more that you empower and do everything that you possibly can, and you feel empowered for your child, and you fight for your child, the more that you are likely to get what is needed.
Yes, absolutely. And also what parents need to remember, that the plan is as good as the reports written by the other professionals. Okay, because it will be based on I haven't mentioned, for example, an educational psychologist will assess your child needs during this process, and will talk to the educational settings, and that will be the majority of the plan. So again, it is as good as the educational psychologist is. And I have to make families aware that the educational psychologist may not meet your child in person, because local authorities really struggle having local educational psychologists assessing children. It's not unheard of having somebody in Liverpool or Scotland, well, probably not Scotland because it's a different law slightly there, but at the end of the world, calling you up on a Teams meeting to assess your child's needs. I mean, I couldn't, so I'm not sure how they can do that really professionally and correctly without seeing the child in their home environment face to face, and in their educational setting face to face. Also, your physiotherapist, your OT, your speech and language, they will all provide information which will then form the basis of the draft plan. But again, it is as good as the system allows it to be. So please don't blame your physio or your OT or your speech and language, because it's personally not their fault. There is a system in place. There's a pathway in place. They have to follow. Okay. And it's generally going to be 6 hours therapy on average a year for your child, face-to-face therapy, and about 8 to 10 hours additional on top of that for paperwork and annual review. I mean, again, look at it. 6 hours face-to-face and 8 to 10 hours paperwork. Again, that's not right, but that's what they allowed to do. That's what the pathway, their local, guidelines allows them to put in there. And it's generally, you look at a provision, health provision for each child, is generally tend to be exactly the same.
Yeah. And like we were saying earlier, the EHCPs, they are dropping. So I have a fact actually that we shared in January 2023, only 25% of all 1.57 million SEN pupils in the UK have an EHCP. Carry on, Eniko. Yeah.
That's just based on that article, which I mentioned it to you earlier. It actually emphasized that their aim is to reduce the amount of requests for assessment and reduce the amount of educational healthcare plans. Because actually, when you look at the system, there's a proportion of a child's provision which the schools have to meet anyway out of their own budget. So if they can reduce that to that minimum, then there's an educational healthcare plan is not needed. The schools just need to make the child's need within their own SEM provision. So that's it's heartbreaking, and but I think parents need to be aware, and also that special educational provision in schools are now far and few between. Our families, there's just not enough. There's just not enough.
And if I could take all of this fighting and having to fight for your child away, I 100% would. But this is why, I'm doing all the podcasts. You could email us about anything you are struggling with, anything you are unsure about. We've had parents email us about EHCPs. We've had parents email us about finding the right outside extracurricular activities for their child, and we have helped every single one of them, and that's what we aim to continue to do, because sadly we cannot take all of this away, and as Eniko said and I've said, it's only potentially going to get worse unless things start to change in what money is given to this side of the world, I suppose, or the UK. So yeah, if you do have any questions at all, please do let us know. Eniko, I want to say thank you so much for doing this podcast and for going so in depth into everything. I know it's going to be a massive help for parents, because there isn't something that walks you through this as you've done, and been so I would say positive about it, because although it's sometimes it can be a kind of negative thing talking about what a child can't do, and being, you know, we're being honest. If we weren't being honest in this, we wouldn't be doing our job properly. We're being honest. It's not easy. It can be difficult. It is long. It is a long process. It can be exhausting, but if you have the people there supporting you, and you have that information, and you know your rights, you know where you can go with this, and you know that your child will get what they deserve to have for their life in education. So thank you very much. I will put all the information in the show notes. I'll get everything off of Eniko to make sure we have all the websites correct, so you'll be able to just click on them from our show notes. But yeah, if you have any questions, please don't hesitate to ask us. Thanks for listening.
Thank you for tuning in to this episode of Disable Label Podcast. We hope you've been inspired, empowered, and reminded that together we are stronger. If you loved what you heard, don't forget to hit that subscribe button, leave us a review, and share this episode with someone who needs to hear it. If you have a story to share or want to be one of our next guests, we'd love to hear from you. Reach out on social media or drop us a message. Until next time, keep breaking barriers, keep lifting each other up, and as always, keep disabling those labels.